proposition that we're putting forward today is Whanau Ora the future for integrated care, and will it work for all New Zealanders? Dr. David Denby suggested this morning that in 10 years' time, the conversations wouldn't be about patient-centred, they'd be about family-centric. And for those who don't understand Kiwi, Whanau Ora means family health or healthy families. So when we're talking about better, sooner, more convenient, closer to home, getting well, living well, staying well, all of those things that Darren loves, this is exactly what Whanau Ora does, all with an eye on creating a social return on investment. And it's very clear that it puts whānau in the driving seat, and so we're suggesting that all of New Zealanders might wish to be in that position and to be in the driving seat and to have Whanau Ora working for them. So Whanau Ora is embedded in the roots of the urbanisation of Māori in the 60s and 70s. For those who don't know our history, in the mid-1950s in New Zealand, 78% of Māori lived in rural settings. Just less than 20 years later, 78% of Māori were living in urban settings. Along the way, we lost elements of our language, we lost our iwi affiliations, and we lost our community connections. And from those roots grew Whanau Ora. So political lobbying at the time saw the establishment of the National Urban Māori Authority, and the National Urban Māori Authority was followed up by MUMA, Manukau Urban Māori Authority, and they started building marae in urban settings, and they built marae to connect communities again so that whānau had somewhere to join. They created marae and built centres of excellence and started delivering services to whānau out of those centres of excellence. And one of the first things that we'll remember is Ko Hangareo, which started out of that first marae in Auckland. And our famous marae is Hawani Waititi, which many ministers and including our Prime Minister attended this year, so that they didn't have the hassle of going to the far north. So Whanau Ora Today is a coalition of 6 government agencies, and they are working in a collective impact alliance. And if you are reading up about integrated care, you'll understand that a collective impact alliance is usually an alliance of a cross-sector: education, health, housing, social, economic. And we're doing that really, really well. So our Whanau Ora model has been adopted by the US. In the US, they have renamed their model Te Wāhi, and today, as we speak, Whanau Tahi is rolling out its technology to enable that Te Wāhi model of care. In Europe, they have embraced integrated care, and the International Foundation for Integrated Care is focused on the science and practice of integrated care on the basis that it's more efficient, more effective, and in the words of their Dutch CEO, it's a much better and cheaper way of doing things. And so the International Foundation for Integrated Care has sought a strategic partnership with Whanau Tahi based on the Whanau Ora model, and they are going to establish a New Zealand chapter this year with a conference here early next year. Where are we clicking to? We're clicking to the determinants of health. So if we just touch base again on the determinants of health, so our 6 government agencies are focused on the determinants of health, and the adage is that we only become ill if we don't have the resources to stay well. At a national data hui last year, these questions were put to us by Bill English as a challenge to the Whanau Ora providers. And rather than me speaking to them at the end of the day, given that I'm sure you all want to be out of here, what we've done is pulled together a couple of videos from the front line which speak to these questions. I must point out that these are not Universal Studios budget videos. These are Whanau Ora homegrown videos. The first one is a young family, and they're identified as high needs, complex, at risk. And Whanau Ora has wrapped services around them, and in this conversation you will hear from them talking about Joy, and she's their navigator.
When we were first pregnant and were introduced to tai whenua, we made a 5-year goal to have our own house, a car,
builder,
be a builder, and finish level 3, then do my degree. And it's been not even 3 years yet, and we've accomplished all of our goals, so we need to set some more. The plan had goals and then solutions and problems like that we might overcome, and we had a plan in place in case we came to those barriers.
Oh, Joy definitely helped me with getting me back into course, because I was getting pushed out of it because of who I was and the way I was and the brain I had. People didn't want me to succeed, and Joy she was definitely a big help. And like, if someone wants to push me out of the picture, and I'll just won't worry and leave. Like, no, that's why Joy was a big help for me, because she told me, no, you have to do this because it's your life, and people are just trying to mess your life up when they shouldn't be.
And just one chance was all it took from Joy's meeting, eh?
Yep. Yeah.
Let's set up the rest of our lives.
I'm playing the fielder.
We wouldn't have our house. We would be on a waiting list with Housing New Zealand if it wasn't for Joy. We went in for a meeting to decide which neighbourhoods we would prefer to be in and not be in at all, and we walked out signing the papers to the property, like, all from Joy. It's just a big support. Like, Joy was more than a youth worker to us. She's our friend. We talked about our lifestyles, her grandkids, and you just felt so comfortable, like you could talk about anything. We had no carpet in our house, and we got carpet put in. It's insulated. That helps a lot. Like, we haven't been getting sick as much, and it's just a lot warmer in the winter. It was visually always there. You can imagine yourself being where you want to be.
I want to eventually own my own business, and I don't know, look at just maybe buying houses and renovating them and reselling them as a business. Or
it's a good feeling knowing you're going to be successful. Like, there's no doubt about it. We already know that we're going to be successful. It's just a matter of getting there and doing the steps that we need to.
So that's the power of agencies working together and creating outcomes, meaningful outcomes for whānau. And you would have heard Lani in that clip say, we don't get sick as much. So you address the determinants of health, and you don't have the admit and readmit rates that we're seeming to get more and more today. The next video is from a couple of leaders who are delivering Whanau Ora services, and just listen out to Vicky, who's the clinical lead nurse. Listen out for her challenge to us and to the ministry.
Kia ora, my name is Tupuia Winiata. I hail from Tauranga Moana, from the Takitino Waka, and my iwi is Ngāti Ranginui. My hapu is Ngai Tamarawa. I'm the CEO of Turiki Healthcare. We're based in South Auckland, in Mangere. The population that we serve in South Auckland have high and complex needs. They're whānau that find it very difficult to access services for a variety of reasons.
Hi, I'm Vicky Maiava. I'm the nurse lead here at Turiki Healthcare. I've been here for over 8 years. And my role is to oversee the nurses in the GP clinic and also be the clinical lead for the what was once the rheumatic fever program is now the school network health team. Turiki has always worked with whānau. We've always had a wraparound service. We've got lots of social services at Turiki Healthcare. We have a lot of parenting and wellbeing classes for our mamas and pepes. So for us it's always been around what we can do for the patient, but also what can we do for their whānau. So whānau has always been a big program with us. Turiki has 2 MDT meetings per month. So we talk about patients who are at risk. We talk about their care and what it is that they've done, and we give suggestions or think of new ways of treating or caring for that patient as well as their whānau. It's been really interesting because some of those patients we've been able to offer our Whanau Ora navigators to be able to work with those practices outside of our organisation. The navigator does that whole wraparound. They sit with the patient, they've discussed with them what the doctor wants from them, but what the other external providers are wanting from them, and they work together to make sure that that plan is working for them.
The strategy is about listening to your community and to the needs that people have. There was a recognition that people also had social needs to be addressed, and unless those social needs were addressed, then we weren't going to improve the health of our community. We then decided as an organisation to open a GP service, and also now we have a suite of parenting services, of maternity support services and Whanau Ora. It's about the relationships that each of the services and the service streams within Tūtaki have that weave together that service. With Whanau Ora, we've done the hard yards. It was a huge cost to the organisation to mobilise itself and work with partners to develop a service delivery model and to look at sustainability of Whanau Ora. Throughout that development, we really needed to keep whānau at the centre of that development. With Whanau Ora, we've now amassed, nearly 6 years of data around how to work in an integrated way, and I'm hoping that finally government will see that this is a more sustainable approach, because we've had to do the deep dive and understand what it is to be an integrated care provider.
Now that the Whanau Ora navigators are going to be able to access those care plans as well, because that's what they're pushing for, it'll be a huge wraparound service that the social side will actually have an input in there as well. So it won't be just the clinicians from the hospital or from here or from any other external provider saying this is what we want, this is the goals that we've set, this is what the patient needs to do. We'll now hear from the social side saying this is what the patient has to do with whānau, this is what the patient needs to be able to provide for whānau, and we can actually all work together for the best outcome for that patient. And those social workers, those navigators, whatever you want to call them, actually are working with them to make sure that their health is maintained, but the social side of their lives are maintained as well. If we can make those or bridge those gaps between the doctors from secondary care to primary care, we can all work together. The outcomes for the patient's got to be improved.
So the push there is for Whanau Ora providers to have access to healthcare data. And I was delighted to hear Darren speak this morning and suggest that, in quotes, information that is accepted and trusted, secure, reliable, safe and convenient, and I'm hoping that what you said, Darren, is that then this information could be accessible for use by industry and consumers, and presumably Whanau Ora providers. This is exactly what Whanau Ora providers are needing to create more meaningful outcomes for whānau and to inform future service provision where there is a measurable return on social investment. Thank you.